welcome to the Knox Healthcare Free to Speak Up podcast.
Thank you, and thank you both for joining me this morning. I really appreciate getting us all together to have the conversation about speaking up. I mean, as a trust, we are kind of fair to middling, really, with the sort of speaking up agenda. The good news is, so the National Guardian's Office had a Freedom to Speak Up index that they used, looking at specific questions within the staff survey. And what they did was they came up with a kind of median percentage so that we can have a sort of quick glance at what the culture of speaking up is within the organisation. So the 2018 survey, we were sat at 76%, but the good news is the 2019 survey puts us at 77.5. So we've had a little nudge over the last 12 months in absolutely the right direction. And the same with the KISS survey that the Trust's been running over, I think it was between May and June. So the staff survey told us that 68.6% of staff felt safe to speak up, but the more recent KISS surveys told us that that's now actually 73.6%. So it's definitely a nudge in the right direction about how people feel around speaking up. But I guess my question is, what can we do further, and thoughts really on how we can further improve what it's like to speak up and listen up within the organisation? And I didn't know if either of you had any particular thoughts on that.
Yeah, so shall I go first and then get Paul's reflection? So I think the first thing is this is of fundamental importance, personally for me, but I'd like it to be something that across the organisation we have a culture and a way of doing things where it's felt that that speaking up is the norm. And it doesn't always have to be as a prelude to a grievance, because there's lots of things that can be sorted out with a decent conversation and listening approach. Those figures you quote are heartening, aren't they? Things go in the right direction. But the people that will know me, that actually I'm quite competitive and I don't like to be fair to middling. So the ambition is for speaking up across the organisation to be seen as one of the best in the country, and that Knox Healthcare will be renowned for having a flourishing culture around speaking up and supporting people with all sorts of issues. In some ways, I'm not too concerned that things haven't gone up that much, because I think the important thing is that all this is based on culture, values, respect and behaviours, and those things take time to turn around. And I know we've come from quite a sticky place, but things go in the right direction in a considered way. It gives me confidence that we're starting to do the right things, but importantly it's being embedded across the organisation. But I'm certainly not complacent, because I know there's still a lot of work to do. Initially good progress. But now I think it's the time to really think about, so what are the next steps for us?
Yeah, I'd certainly echo that, and that competitiveness bit that John mentioned. I'd say for me, fair to middling isn't where I want to be in any of those tables. Actually, we need to be heading to what we would describe as outstanding. And I don't mean that just in terms of what the CQC might say when they were looking at us. It's actually about a part of us being an outstanding employer, which is where I want to get to. And I suppose that the bit that really interests me is, in order for us to make that step change, rather than the nudge that you clearly described there, Helen, is that we need to understand what some of the barriers or perceived barriers are that prevent people choosing to speak up. And I read the reports that come through from the National Guardian's Office, and I know that some of those themes, that are things like people fearing that it's going to have a negative impact on them, or you're just not trusting that anything's going to change. Some of those sorts of themes, I think, are ones that, I'd like to get your view on what some of that context might be for some of our staff, just so that we then start to think about, okay, well, what is it we need to do differently? And as John said there, I think this is a key piece of this kind of cultural change journey that we're on as an organisation. And I've seen, even over the last few months, I've seen some really, really positive elements within that. But I'm also not naive enough to think that then means everything is being sorted. So just that's just sort of an initial reflection.
Okay, absolutely. And I think, yeah, there are still some barriers, but I think that there's two sort of sides of that. There are some real barriers, but I think there's also just some perceptions that are ingrained, and that takes time to remove some of those perceptions or past experiences. And perhaps staff need to be in a place for a longer time where they really start to see that actually it's okay to speak up and you will be listened to. I think there's some work around listening up. I think if people feel heard, that they're more likely to speak up and, you know, acting on what's being given. I think speaking up is a gift to the organisation. You know, it's really rich data. And maybe what we've not always done right is the listening up bit, which then becomes another, you know, another barrier. And I think more so now, I think during the COVID pandemic, we were written to by both Dr. Henrietta Hughes as the National Guardian and Sir Simon Stevens around actually now more than ever is crucial. Yes. And I'm thinking as we go forward into the kind of recovery and restoration, how we actually engage the whole Freedom to Speak Up network, including the champions within this trust, as to what that richness offers. And I suppose what your thoughts might be is how we engage the Freedom to Speak Up network as part of that restoration piece of work.
Yeah, the restoration bit is interesting, isn't it? And it's becoming increasingly complex. And I think we're all finding out the truism around it. It's very easy to stop things. Not that mental health particularly stop things or community services, but that starting things up again is more fraught with challenge. Having to cope with living with COVID. You know, we've just seen this week, haven't we, the potential impacts on a lot of our staff that live and work in Leicester. So it's far from straightforward, and all the things that generates means we've got to be really agile and flexible about how we support all our staff and volunteers and others to be informed and to be able to do their work in really difficult circumstances that are rapidly changing, because we're all in a position where not only are we managing the work bit, but we've also got our own personal family concerns and worries, haven't we, to manage on top of everything else. So I think it's doubly difficult, and therefore massively important that we enable this for all our champions and people that are interested in this domain to be supported to do the work that they do.
Yeah, I agree. I agree with that, John. I think I also really like what you're saying there, Helen, though, about the kind of putting out the challenge there around us ensuring there's a culture of listening up. Because I think that's an important piece, particularly if for some of our staff historically they felt that they just weren't getting heard. And I know that something that I recognise with speaking up is that if somebody is in a space where they're thinking and considering speaking up, actually most of the time can be a really brave step to do that. And it's not always simple and easy to speak up. And I know that it's one of the things that you're very passionate about, is enabling people to come to you. But also I think we need to make sure that organisationally we're getting it right in demonstrating that, first off, we absolutely value hearing from people. And I agree with your phrase there. For me, feedback is a gift. It's something that I have said in conversation with John before, and whatever that feedback is, sometimes it's harder to hear it but that doesn't mean to say we shouldn't be listening to it. And I think there's a job for us to not only to be listening fully, but also to be able to then work out, how do people know that we've been listening? So what does that look like? What does the evidence look like? Where's the so what and the follow through from that listening? And I think without that, if people then feel like, well, I've taken the risk, I've spoken up, but nothing's happened, nobody's heard me, they're not going to speak up the next time. And actually, we need to turn that around. And I'd say I'm very positive and open to hearing from our staff. I've just started in the last couple of weeks, finally being able to do some induction visits to some of our sites and different parts, different services. And one of the joys for me is being able to, first off, not be chaperoned around by somebody really senior, but be able to speak with and listen to staff in whatever that service is. And I've already seen a wide range of services across all of our divisions, a lot more to see to come. But a part of that is listening intently to what people are saying, and also asking about what is it that needs to be different. And I know that every time I've done a visit, if there's things that I think I've promised that will get followed up on, the first person who I have the conversation with is John. And it's a really important piece of that feeding back. And I think what comes through from the Freedom to Speak Up Guardian network is a piece of that. So I think we get that need to be doing the listening up. I suppose one of my reflections over the COVID piece as well is, what more do we need to do? Because I think that it has enabled us to think differently about so many of our services and so many of our different ways of working. There must be opportunities in terms of how we engage with our staff around freedom to speak up. I wonder if you'd got any reflections around some of that.
Yeah, I think there is something around senior leaders within the trust being available. So ideally, in the perfect world of speaking up, nobody would ever come to my door to have to speak up. That would be the ideal.
Absolutely.
So I think there is something about our senior leaders, our middle managers, well, everybody really pulling and engaging the speaking up. It's not something to be frightened of. If somebody's got something to say, then they need to say it. And we hear a lot about the freedom to speak up process. There isn't a freedom to speak up process. Freedom to speak up is an enabling cultural addition to the organisation. And I'm trying to sort of help us move away from going down the process, because it's not that. And actually, ideally, one day, I won't get any emails or phone calls, because I won't. Everybody will just be speaking up as business as usual. So I suppose for me, it's something about that listening up from yourselves as senior leaders, but I guess something overarching within the trust that everybody has that opportunity. So I think that's an engagement piece of work that we could look into.
I'd agree with that. Apologies if you hear a honking car horn on this. Someone seems to be blocked on the one-way system around headquarters, and
we can't hear it, John.
their way of clearing it is to sit in the car peeping the horns, and it's clearly not working.
They're trying to speak up.
Just to develop that though, because from my clinical perspective, being a psychiatrist, the power of listening to people is huge, and I was regularly struck by the fact that I might have spent quite a lot of time in a clinic listening to people discuss all sorts of very deep and personal issues, and oftentimes I'd be sitting there thinking, well, what can I do? What am I going to do? What am I going to say? And I was always often quite surprised that the very process of being able to talk in a safe space was therapeutic in and of itself. And sort of use that analogy to some of the sort of principles of speaking up. And So to develop that, one we were talking about what we can do more to reduce the barriers and enablers. I think there, and you've referenced it, Helen, is about how we can support managers at lots of different levels, feeling confident and competent about being able to do that, not with the expectation that they have to do something all the time, but listening attentively and responding appropriately is important. But the hearing it is critical, and often what people want is an acknowledgement, if appropriate, that an error was made, and we say sorry. And sometimes we back ourselves into an increasingly complex corner because people don't feel able to do that. And if I say sorry, it's therefore I'm culpable, and all sorts of bad things happen. But we're human, aren't we? And we work in a complex human organisation. And I make errors, I make mistakes. Paul's often telling me about that. But as long it's okay, as long as we learn from it and move forward. And again, I think that's a part of the freedom to speak up that I'd really like to sort of further develop.
That kind of expression almost of the duty of candor, and for us to be able to develop that culture where it is genuinely. I know it's easy to say that we want to have a no blame culture. I know that in some organisations, and I think indeed at times with our trust, for some of our staff, the experience has been that actually no, we haven't achieved a no blame culture, and in that kind of context, then I understand that that people may then get defensive in their response to people speaking up, but that doesn't lead to resolution. It doesn't lead to sorting out issues, and it then gets in the way. And I think that's a point when things escalate in different ways as well. And I would like what you're saying, Helen, about ideally we want to be in a place where actually you're not getting stuff coming through to you. But there's also a piece for me, and I think you're describing this as well, is that whilst absolutely, as part of the freedom to speak up Guardian role, that you have got open door access to both John and myself. The ideal is that actually you never have to use that, because you're able to engage with somebody who's much closer to whatever's been spoken up about, and to work with them and support them to resolve whatever's going on. And I think that then plays into how we need to look at how we support our leaders and our managers in being able to work well with the information that they're getting through freedom to speak up, as well as other pieces of feedback. Does that kind of make sense as a concept there?
Yeah, absolutely. And I think the first port of call whenever somebody's got a concern is let's try and engage this at a very, very local level.
Yeah.
And actually, over the 4 years of being in role, we are getting close to that. So there are some particular areas in the trust I know I can very easily engage with those leaders and we get to a quick resolution. So that's good news.
Mm-hmm.
We're not completely there 100% over the trust, but absolutely that would be the ideal. And yes, it's great that I have open access to you both. I think, to be fair, I've not really overly burdened you over the time that you've both been in post with freedom to speak up issues. And we have a proper reporting mechanism and governance around speaking up, so that's really great. And hopefully we're going to go in the right direction with some of these reflections, and when I've watched this pod chat back later, I'm hoping that will actually help frame some of the thinking now about what next. Definitely.
Yeah, and I think that looking to the what next piece, where we started early on about talking about that recovery and almost the reset elements of this, I think part of what our thinking is at board level is the opportunities that we've got in terms of being able to think differently about key pieces of our work. And I think there are some real opportunities for us to look at freedom to speak up and to think about, do we need to invest some different things into freedom to speak up, whether that's in terms of supporting different staff, different thinking, really looking at how we embed this as part of our culture into the future. So I think it's exciting for us, actually, Helen.
Good. It sounds like we're all sort of singing from the same hymn sheet.
It's good.
It's good. We're aligned. So do you think we've probably come to a natural?
I think we've come to a natural end, and thank you both very much for spending some time out of your busy schedules for us to reflect and speak about this. So thank you. And
thank you, Helen, and thanks for your work on this this freedom to speak up. I think I know that sometimes that you are listening to some quite challenging experiences of our staff, and I really appreciate you doing this work for the Trust. So thank you. Good to see you.
I'd echo that. Thanks a lot.